Hi everybody, 2 questions. One is easy, one is hard. So the first question, how do I get my 5-year-old to wear underwear? It's not really a medical question, but as a parent who has the same issue, I mean, not that I don't like to wear underwear, but having a son that doesn't like to wear underwear, I think it comes down to comfort and style. I think you need to look at smooth and silky and something that holds things together in there, maybe with a superhero on it, like Batman, Black Panther, Superman, I don't know, something like that. Okay, anyway, next question. This is a difficult question because it concerns George Floyd. There have been a number of comments from people, some questions about the mechanism of how he died. I don't think there's any question of what happened when he died, that there was compression to his neck by a knee. But people have thrown out some ideas. Well, he was COVID or coronavirus positive, so maybe he died from that. Another person said, well, maybe he just happened to have a heart attack. Okay. Another person said, well, he was talking, so if you talk, you can't get choked to death. All of which are not really relevant. The best way to explain this, any compression to the neck, whether it's a hand, whether it's a knee, whether it's legs, anything that you do to compress the neck, I think is best explained by this. This is mixed martial art fighting, whether you agree with it or not, whether you agree with this hold or not. This is called a choke hold. The idea is you compress the arteries of the neck, and what happens is the blood flow decreases to the brain and the person becomes unconscious. That's the nature of the hold. These arteries right here are 2 branches of the carotid. The carotid artery comes up here from the heart and feeds the brain. When there is compression of 80% of the arteries, which is what a chokehold or a neck compression is about, within 10 seconds, that victim becomes combative, confused, or will lose consciousness. If you continue the compression of those arteries, within a minute, brain cells begin to die. If you continue that compression to 4 to 5 minutes, that's when brain death occurs. That's why in MMA fighting, because that hold and that neck compression is so brutal, as soon as someone taps out or says they can't take it, the hold is discontinued or stopped. And if the referee sees that that person or that wrestler or that fighter is becoming unconscious, the referee jumps in and stops the chokehold right away. So the mechanism of action of death is very clear. That is really ugly truth of what happened. You may want to discount it or try and excuse it away, but that's what happened. It's a result of a compression and a failure of blood flow to go to the brain, which could have easily been alleviated. So like I said, that's the truth. I don't want conspiracy theories to confound what's happened. This is just a heinous thing that we've done to each other. And that's the objective evaluation. Okay. That's it. I hope you have a peaceful and relaxed weekend. Bye-bye.